Welcome back to MLT 120. Now we're going to learn how to do manual platelet counts and platelet estimates. So why would we need to do a manual platelet count or a estimated platelet count? In the case where there's interferences with our automated counts, when we do our CBCs, we might want to do a manual or an estimated platelet count, or if a patient has a low platelet count. Our specimen, just like all the other specimens we've been using in hematology, is our well-mixed whole blood in our EDTA tube. We prefer a venipuncture sample for the platelet count because platelets often clump on smears obtained from capillary collections, and that can contribute to imprecision in results. So we just prefer to get venipunctures. One procedure that you can use to do a manual platelet count is to use a hemocytometer. And the procedure for using the hemocytometer for a manual platelet count is very similar to the procedure that we use for the white blood cell count and the red blood cell count for the hemocytometer. You can dilute down your whole blood to do the platelet count. You can use the Unipet device to make the dilution. They usually come with pre-measured volumes of a diluent, so you can easily dilute down your whole blood. But usually what we dilute down our whole blood to is a 1 to 100 dilution for the platelet estimates. If you use any kind of solution to lyse the red cells to get them out of the way, you're going to allow it to stand for 10 minutes. After the 10-minute wait period, you're going to load your sample on the hemocytometer. Remember, you're going to load both sides of your hemocytometer, chamber 1 and chamber 2. Then you're going to put the hemocytometer on the microscope, and you're going to read the slide at the 40x objective. You're going to count all platelets in all 25 of the small red blood cell counting squares in the very center of your hemocytometer. So when you're doing your platelet count, this is what you're going to be counting. All 25 of the small red blood cell counting squares. Remember, you're only going to count platelets that lie on two sides of the square. So you can count the ones that lie on this side and the ones that lie on this side. Do not count the ones that lie on this side, or you'll skew your platelet counts to the high side, or they will be falsely increased. So when you're looking at this, these little red dots are representing all your platelets. So you would count all the little red dots, and if any were on this line or this line, you would count them. If they were lying on this green line or this green line, you would not. For the calculation, we're using the same formula that we use when we use the hemocytometer for the white blood cells and the red blood cells. It's the average number of platelets counted times the dilution, if you used a dilution. If you didn't use the dilution, you just plug 1 in for a placeholder, over the number of squares counted times the volume of each square. And we counted red blood cell counting squares, and the volume, remember, is 0.004 millimeters cubed. So that's the volume that we'll be plugging in. And for number of squares counted, you'll put 25 because you count all 25 red blood cell counting squares for a platelet estimate with the hemocytometer. Now, we need to talk about how to do a platelet estimate. We just did the platelet count on the hemocytometer procedure. Now we need to know how to do the estimate. So when we make our smears and use the right stain, we can do an estimate with that smear. We can look at that smear using the 100x objective, and we want to be looking in an area where our red cells are just touching but not overlapping. So a good area out on that, close to that feathered edge, and we're going to determine the average number of platelets in each field. Okay, so we're going to count when we get to a nice area where the red cells are just touching, how many platelets are average in each field. Okay, and then you're going to take that number, your average number of platelets per field on your high power, your oil objective, and you're going to multiply that number by 20,000. Again, this is an estimate, so if you did an automated platelet count on your automated analyzer, it should agree within 20%. Okay. If a patient has a normal platelet count, the tech should be observing between 7 and 20 platelets per oil immersion field. Okay. We'll be practicing this in lab, so hopefully you'll get a good feel of how to do a platelet estimate. This concludes our lecture on the manual platelet count and platelet estimates. If you have any questions, don't hesitate to reach out, but we'll be practicing these procedures in lab.